As we travel the country working with and talking to improvement districts, the most common factors affecting safety perceptions in downtown center around the issues of homelessness and panhandling. While each city's homelessness and panhandling issues vary in size and complexity, the effects are relative to each city. In response to this common concern, Block by Block has developed a social service outreach program. After providing basic outreach services in varying degrees in many of our cities through our safety programs, we've created this more focused outreach model. This new format accurately defines engagement protocol and the steps necessary to effectively deliver services. As well, the model outlines important steps to gather data and to promote accomplishments to stakeholders. Bringing together these finer details and considerations into one operating model has allowed us to create a very effective solution to homelessness and panhandling, which are probably two of the biggest issues affecting your stakeholders. As you consider this model, it's important to keep in mind that homelessness and panhandling are two very distinct issues, but we've created a model that addresses both. At the heart of the Block by Block outreach model are social service ambassadors.
We purposely hired people for the street team program that have expertise in social work, nursing, psychology, and those kinds of things. They're terrific people, they care about people, and so they are better suited to channel those homeless people into the necessary services that they need.
What we try to do is we do homeless outreach. We try to discourage panhandling. We try to make people feel safe and welcome, comfortable. If they happen to be a panhandler or a homeless person, to try and ask them, what is it that you need? How can we help you? Is it that you're hungry and you need a meal? And then we have several places or services we could hook them up with. Or if they're homeless, are you looking for permanent shelter? Do you need medical attention? Things like that.
While our programs will vary in complexity and operating details, the effectiveness of these programs is hard to dispute. The results are not only statistics of people connected with services or moved off the street, but they are the stories of real lives that are positively affected by the downtown organization.
This past February, we met a man named Ernie who found himself on the streets here in Pittsburgh. It was in mid-February and the weather was terrible. He had a number of health issues, including diabetes, and had been sleeping on the streets and not sleeping for long periods of time. We were able to work with a local transitional housing building to get him through the interview process as well as get his proper documentation together so that he could get a room of his own.
There was a young man, he was about 23, and he was on the streets for 3 weeks, and I helped him get a resume together. I gave him a sample of my resume and got him up to Operation Safety Net, and now he has 2 job interviews this week and he is in the process of finding housing.
We'd love the opportunity to tell you more about the details of our social service operating model and give you some ideas on how we can customize an outreach ambassador program specific to your city in order to mitigate the negative perceptions associated with homelessness and panhandling.